Hello students. Welcome to chapter 17, Concepts of Care for Patients with Allergy and Immunity Conditions. And this is part 2. We are talking about general autoimmunity right now. We already explained angioedema, anaphylaxis, the 4 types of hypersensitivities, okay? So general autoimmunity, is a process in which an inappropriate immunity develops to a person's own tissues. In this response, the body antibodies or lymphocytes are mistakenly directed against the body's own healthy normal cells and tissues, not just against invaders. So commonly autoimmune disorders, we have the ankylosing spondylitis. I think we can watch a short video related to this. Let's see. Ankylosis. We reviewed this already in the musculoskeletal part. Okay, let's see. Okay, here we go. Here we go.
Ankylosing spondylitis is a type of arthritis of the spine. It causes swelling between your vertebrae, which are the discs that make up your spine, and in the joints between your spine and pelvis. Ankylosing spondylitis is an immune disease. The disease is more common and more severe in men. It often runs in families. Early symptoms include back pain and stiffness. These problems often start in late adolescence or early adulthood. Over time, ankylosing spondylitis can fuse your vertebrae together, limiting movement. Symptoms can worsen or improve or stop altogether. The disease has no cure, but medicines can relieve the pain, swelling and other symptoms. Exercise can also help.
Thank you very much. So there you go. You have the definition of ankylosing spondylitis. Okay, there are 3 Ds of the spine. Also, we have autoimmune hemolytic anemia, autoimmune thrombocytopenic purpura. I hope you can identify thrombocytopenic is the reduced number of platelets, right? Celiac disease, Crohn's disease, dermatomyositis, eczema, Graves' disease, Guillain-Barré syndrome. Also, we saw this in the neurological part of this semester. Hashimoto's thyroiditis, you're going to see that in the next semester when you speak about the endocrine part. Multiple sclerosis, myasthenia. You have a long list here. We review already rheumatoid arthritis, Sjögren's syndrome, very briefly. Type 1 is going to be reviewed next semester. So ulcerative colitis as well. We spoke about it, okay? So the development of autoimmune disorders is complex, involving genetic susceptibility and environmental interaction. Environmental interactions. All that includes your stressors, the type of food you are eating, if you have different contact with radiation from microwave all the way to radiation therapy, right? Including your cell phones, right? If you are drinking water with toxins, right? All these different type of environmental. If you are using products high in aluminum, okay? So patient-centered care, gender health, autoimmune disorders affect 3 times more women than men. And then the genetics, the genomics studies have confirmed that a strong link between genetic inheritance and autoimmunity is present. One family may have several extended generational members with more than one autoimmune disease. So basically, once you have one autoimmune, you're going to develop another one. As I always mention, ask your doctor for genetic testing. It's very important, this part. So at least you know what is on your system, but does not mean that you're going to develop the same the same autoimmune condition, right? You can have different, but at least you know what genes are present in your genetic history. Self-reactions can form against one type of cell and cause problems only for a specific tissue, organ, or system. An example of a selected autoimmune disorder is myasthenia gravis, in which the person makes antibodies against acetylcholine or the acetylcholine receptor on muscle cells, and transmission of nerve impulses to the skeletal muscle for contraction does not occur. We knew that about myasthenia gravis, right? So self-reactions can also be directed against a specific tissue component or multiple components that are present in many organs or tissues, resulting in widespread problem or symptoms such as in systemic lupus erythematosus or rheumatoid arthritis. I'm going to read that paragraph again because I really want you to understand. Self-reactions can also be directed against a specific tissue component or multiple components. That's why they are complex immune reactions. Okay, this is type 3. The ones that they are mentioning here in this specific paragraph is type 3 reactions, right? In this paragraph, okay, multiple components that are present in many organs or tissues, or tissues, resulting in widespread problem, of course, because there are many organs or tissues, or symptoms such as in systemic lupus erythematosus or rheumatoid arthritis. Okay, very good. So we saw already rheumatoid arthritis in in a previous chapter. Okay, now let's enter systemic lupus erythematosus. This is type 3. Okay, type 3. Okay, so systemic lupus erythematosus is a chronic and progressive autoimmune disorder in which inflammatory and immune attacks occur against multiple cell tissues and organs. Over time, the progressive loss of tissue integrity through excessive inflammation and overactive immunity leads to organ failure and death. Okay, there are 3 lesser common types of lupus that only affect the skins, and these are the acute cutaneous, the subcutaneous type, and the chronic cutaneous lupus erythematosus. So the pathophysiology is circulating autoantibodies attack tissues, causing a type 3 hypersensitivity reaction with formation of immune complexes that precipitates and deposit in various tissues, resulting in some degree of impaired tissue integrity. Okay, these actions cause systemic inflammation and attract other immune cells and products to the sites, which then induce chronic tissue injury and destruction. Compounding this general problem, blood vessels are the major targets. That's why lupus is so difficult to understand, and sometimes it's difficult to diagnose. Okay, the theology and genetics. Okay, where are we right now? Okay, let's go here. Let's review again. Compounding this general problem, blood vessels are major targets, leading to chronic vessel inflammation, vasculitis. That's why this is a systemic condition, right? Which reduces organ perfusion and increases the risk for permanent damage and injury. So when we have organ lack of perfusion, right, we don't have good oxygenation. That is why they put the organs in risk for permanent damage and injury. Most common causes of death are chronic kidney disease and cardiovascular impairment. Arthritis and joint pain occur in virtually all patients with systemic lupus erythematosus. So in these 2-3 lines, I mentioned various organs. So that's the extent of this condition, right? I mentioned about the chronic kidney disease, cardiovascular impairment, arthritis, joint, right? because of this vasculitis. Although chronic and progressive in nature, symptoms associated with systemic lupus, I'm going to call it lupus right now, SLE from now on, okay, may be present constantly at a reduced level, remission, or as an acute episode of increased symptoms known as flare or exacerbation. So either it's going to be on remission or is going to have a flare or exacerbation period, right? So the etiology, SLE, is a disorder that affects multiple systems. It is thought to be related to genetic, immunity, endocrine, and environmental factors that cause the body to develop anti-self responses. So it's a mixture. It could be a mixture of genetic, immunity, endocrine, and environmental all together that can cause this response. Triggers for expression of SLE in a genetically susceptible adult include select viral infections. It could be drugs, hormones such as estrogen containing contraceptives and postmenopause hormone replacement therapy, and exposure to environmental substances. Again, I don't know how many times I mentioned environmental reasons, right? So think about it. It's not only the genetic. We have this wrong concept of that many of the conditions that are happening is because of genetic. No, it's environmental. When I mention environmental, first of all, it's nutrition. Then it's the lack of physical activity. Stress is a major factor. Then other factors like exposure to radiation from microwave, as I mentioned before, all the way to being close to a patient receiving radiation, right? Your cell phone being placed next to you when you are sleeping, next to your head, and your cell phone is there, or you have your laptop next to your head when you are in bed sleeping, okay? Those are radiations, or the TV in your bedroom in front of you, turn on while you're sleeping. That is radiation as well. Okay, all these factors, bad quality of water that you are drinking, many factors. Okay, those are environmental substances, the use of deodorant with aluminum, and many products that we use for skin care or hair care. Okay, also especially ultraviolet rays and sun exposure. In this case, lupus related to sun exposure most of the time. Okay, and we're going to talk about this in a few minutes. This disorder often affects women who are African American, ding ding, remember this, Hispanic, Latina, Asian American, Native American, Alaskan Native, Native Hawaiian, or Pacific Islander woman. The onset of SLE is usually slow. This is very important because this is the reason why it's misdiagnosed. It's slow and the symptoms may be mild, general, or vague. The diagnosis often is difficult and delayed. The average time from symptom onset to actual diagnosis is 54 months. It's almost 5 years, right? 5 multiplied by 12 is 60. Right, so almost 5 years from the first onset until the real diagnosis. So patient-centered care, gender health alert, that's good to know. Systemic lupus erythematosus primary occurs in women of childbearing age. Hello, childbearing age. Women of color are disproportionately affected by SLE. When caring for any woman who has a history of chronic fatigue, there you go. This is for me the major, the most important alert, right? The most important symptom that we need to pay attention. Chronic fatigue, recurrent fevers of unknown origin, and persistent joint and muscle pain. Report these findings to the primary healthcare provider for consideration. So fatigue, chronic fatigue, fever of unknown origin, and persistent joint and muscle pain. So after they do all your blood work and there is no reason why you are feeling that way, you must consider lupus. But there is another symptom that is the real one that is going to give you the real diagnosis. We're going to talk about that in a few minutes. A primary healthcare provider is often the first medical professional to to suspect SLE and refer the patient to a rheumatologist. That's the doctor who is going to treat lupus. Now, pain without injury is present, intermittent. That's part of your arthritis or joint pain, muscle pain. Any close relative either have SLE or have been diagnosed with another autoimmune disorder. Bling, bling. Okay, so do you remember? You don't need to have the same genetic autoimmune disorder, okay? It could be another one, but the reason, the most important factor is to consider somebody else in the family is having another autoimmune disorder. Gene environment interaction and explain intermittent fevers. We spoke about this. Increased fatigue. Drug induced SLE can be caused by hydrylazine, which is a blood pressure medication, isoniazid, which is your TB medication, okay, and procainamide, okay, which is your antiarrhythmic for the left ventricular medication. Key features for systemic lupus erythematosus, SLE, you see the musculoskeletal, arthritis, also osteoporosis could be a causative agent or something related to the lupus. Integumentary alopecia, mucocutaneous lesions, the ones inside of the mouth, photosensitivity and rash development after sun exposure. Here we have in your butterfly rash, okay. Your immune, chronic fatigue, increased number of infections, intermittent and explained low-grade fever, cardiovascular, your renal phenomenon, which is the hands that appear intermittently cyanotic. They may become red or pale when exposed to cold. I've seen the type of patients that are having the pale, the cyanotic fingers, you know. It's very weird. It's shocking when you see it. Renal, glomerulonephritis, GI, esophagitis, sensory, peripheral neuropathies, hematologic, anemia, or leukopenia. Okay, physical assessment, pay attention to your pain, arthralgias, rash, and inflammation are the most prominent initial symptoms noted. Skin changes in SLE may be the first observable symptoms and include a dry, scaly, raised malar rash or your butterfly rash, okay? This is due to or is happening after sun exposure, and this is good to know. NCLEX alert, this is the rash, butterfly, okay, after sun exposure. Some people develop this type of rash when they have acne, severe acne in the face, but the differential is the sun exposure, after sun exposure, okay? Also pay attention to intermittent low-grade fever is a common finding and caused by chronic systemic inflammation. Chronic fatigue is common, although the precise cause of fatigue is unknown. Contributing factors include stress, depression, ongoing inflammation, insomnia, often due to persistent pain and infection that people with SLE experience. So then think about your musculoskeletal changes with SLE are common. Also your arthritis, muscle aches, and muscle inflammation, systemic inflammation, and hypoxia caused by vasculitis. The joints most involved are the feet, the ankles, the knees, the wrists, and fingers. And this is another good point. Usually the joint involvement occurs bilaterally. That's good to know. So extremely important. Your chronic fatigue, your fever from unknown reasons, your butterfly rash, right? You know, after sun exposure is not related to acne. Okay, your arthralgias, your joint pain bilaterally. Okay. Also, osteonecrosis, bone necrosis from lack of oxygen, also called avascular necrosis is often seen in patients who have been treated for at least 5 years with steroids. So that's why assessment is very important. What type of medications were you using? Okay, so you have to consider all that. What type of blood pressure medications, if you're taking antiarrhythmias, all the medications, the complete history, okay? Steroids such as prednisone that can restrict blood flow to the joint, muscle pain similar to fibromyalgia. But with fibromyalgia, we have a problem. The problem is that we are having an issue related to psychological factor. So there is a psychological factor. Also, there are tender points, especially in the neck, shoulders, chest, hips, knees, and elbows. Kidney changes occur as a result of the autoantibody attack on the connective tissue of glomerular capillaries and the basement membranes of the kidney tubules with loss of tissue integrity. So there is also cardiac changes that are going to happen, pericarditis maybe, or valve thickening. You need to assess your blood pressure, heart rate, pulse, quality for the presence of jugular venous distension or lower extremity edema. Check capillary refill and oxygen saturation and pulse oximetry. So then you have your psychological assessment. Unfortunately, the myth that lupus is fatal is still common. Ring, ring, that's good to know. Teach the patient and family that regular medical monitoring, drugs, and healthy practices such as limiting sun exposure can prevent exacerbation of the disease and that life expectancy is normal for most people who adhere to treatment. Okay, so we are going to stop here. When we come back, we are going to review the laboratory assessment for lupus, and we're going to finish this topic. Thank you.